talk to him, he talks about that.
He might kick it out to Vietnam or something.
They're doing
Are they doing that now?
Korean and Vietnam.
I knew they were doing Korean when they were doing
Good early afternoon. Welcome to Emergency Response Committee. I would entertain a motion to reconvene.
So moved.
Motion
Second.
and second. And roll call will also be our attendance roll call. Mr. Matthews.
Aye.
Mr. Blau. Mr. Compton is here in his place.
Aye.
Mr. Taylor. Mr. Davidson.
Aye.
And Barnes is an aye, and we do have a quorum. Motion to reopen item number 1, discussion possible action to set date, time, and place meeting, reconvene in the event of technical difficulties.
Move to reopen.
We just did. All right. Can I get a second? I'll second. Thank you.
Sorry.
That's fine. And roll call, Mr. Matthews.
Aye.
And Mr. Compton.
Aye.
Mr. Taylor, no. And Mr. Davidson.
Aye.
And Barnes is an aye. What would be the pleasure of the group in the event of technical difficulty? Just hold off till our next regular meeting on Monday?
Make the motion that any technical difficulties lasting more than 30 minutes would result in adjournment of our next regularly scheduled meeting, which is Monday at noon in this room.
I don't know that we can do that. The item says the meeting will reconvene. It doesn't give us the option of that. So what about 5 minutes before 11:55 on Monday in this room, and we could just wrap it up and end it and start the other one? And we could,
Yeah.
I would second that.
All right. Got a motion and a second. Mr. Matthews? Aye. Mr. Compton?
Aye.
Mr. Davidson?
Aye.
And Barnes is an aye. Thank you. All right. Motion to reopen item number 3, discussion review possible action regarding presentation from emergency management.
So moved.
second.
Got a motion and a second. Mr. Matthews? Aye. Mr. Compton?
Aye.
Mr. Davidson?
Aye.
And Barnes is an aye. Update from emergency management. As a reminder, no anticipated severe weather for the next few days. However, the first week of May, which we are now in, is historically the peak and most significant spring severe weather season week. So I encourage everyone to maintain awareness. Back to COVID, persistence in our preventative measures, including limiting travel and staying at home, is more important now than ever. And President Trump's presidential disaster declaration, DR 4530, COVID-19 still remains in place, with the public assistance category for emergency protective measures being approved. CDC specific guidance recommends wearing cloth masks when around other people, and organizations' continued use of their business continuity of operation plans. State of Oklahoma is still under a state of emergency with the declaration on March 5th and a health emergency with a declaration on April 2nd. Oklahoma County has received CARES Act stimulus funding, which is different from specific disaster declaration related funding. And Mayor Holt for City of Oklahoma City has provided guidance for reopening to begin today to, quote, align with state and Oklahoma hours, OURS plan. And I provided a document with some excerpts, the main excerpts from that, to the Everyone group on the Oklahoma County email system. And I have additional copies available by email or hard copies if somebody would like a copy of that. Basically, I took their 8-page document, pulled the first 4 pages with just the specific bullet points and the information that you need to know and not all the references to other documents. And that's what's in that document. State of Oklahoma, 3,748 positive test results. That's a 130 increase from yesterday. We have 230 virus-related deaths, which is 8 additional since yesterday. Still looking at 95% of those fatalities at 50 years of age or older. Largest numbers are in Oklahoma County with 31, Tulsa County with 33, and Cleveland County with 29. 67% of fatalities had at least one comorbidity situation. 85 seasonal flu deaths since the 1st of September, and there were 23 additional seasonal flu hospitalizations last week. 47,984 tests as a result of the 23rd. That's state and private labs. And we're still looking at 70 counties in Oklahoma with positive cases. 2,467 Oklahomans have recovered from known COVID-19 illness, 731 cumulative virus-related hospitalizations. And per the State Department of Health, there are currently 255 current hospitalizations. Test sites through health departments are spread throughout the state. There's at least 93 of those now in operation. And the hours of operation and prerequisite requirements vary, so it's best to go to the health department, state health department website to see specific information. State Health Department also has an online symptom tracker and data dashboard available for viewing. We are under a gubernatorial declaration of a public health emergency, and under that declaration, elective surgery began April 24th on a tiered acuity scale, and minor medical procedures and non-emergency dental procedures were scheduled to resume as of yesterday for those with adequate PPE. And Oklahoma has met presidential parameters to allow phase 1 reopening. And reopening of the Oklahoma economy began in some phases April 24th, but social distancing, and particularly for the older and vulnerable, is still indicated. And personal care businesses could reopen statewide. State parks and outdoor recreation areas could reopen. Today, May 1st, restaurant, dining rooms, theaters, gyms, and sports venues, places of worship may reopen if using social distancing and sanitation protocols, and tattoo parlors with appointments only. And during phase 1, visits to senior living facilities and hospitals are still prohibited. Bars, schools, organized sporting events, and camps still remain closed. And we're currently monitoring the hospital and incident rates, and if we have what's termed manageable rate for 14 days, we'll be able to move to phase 2. Stress to everyone to know local guidance, as your local jurisdiction may have different parameters and guidance than what you may see from the state or neighboring jurisdiction. First responder protections, jurisdictions are still receiving information regarding positive cases in their jurisdiction. Oklahoma National Guard is still under deployment with several medical-related missions, and they are assisting with the Strategic National Stockpile. State Health Department report on correctional facilities, 19 staff members and 5 inmates have tested positive. Department of Public Safety is reopening some locations today, the 1st of May, requiring appointment and a mask for people who are going to be requesting services at those locations. And Oklahoma Forestry Service continues support of the personal protective equipment distribution. In Oklahoma County, 816 positive cases with 31 fatalities, and as of the 30th, 481 total recovered. And there are now 23 positive cases at Tinker Air Force Base, and there is still restricted visitor guidance and revisions in available gates in place. There are now 3 test sites available in Oklahoma County, plus private labs. Fairgrounds Bennett Center, Monday through Friday, 9 to 3 with appointment only. Then the Walmart, 3301 Southwest 104th, also appointments only, and it can be scheduled at www.doineedacovid19test.com. And the third is at the University of Oklahoma OU Physicians over on Northeast 10th Street, and that is also by appointment only. Information hotlines remain in place and active. City County Health Department Nurse Hotline at 425-4489, and State Health Department at 877-215-8336. Sheltering operations are continuing in several locations or in the metro, a couple of primary locations that we've been talking about for weeks now. And they are anticipating potential increase with the reopening activities and other factors, and caution is certainly being exercised with potential increased caseload. And they are aware of the fact and are monitoring that illness tends to hit the homeless population after the general population, so there is additional monitoring in that regard. Concerns over possible increased homeless numbers also due to possible evictions with the overall financial situation. Shelter staff and guest screening continues. The Helping Hands organization under Mary Mahoney Memorial Healthcare is still helping oversee testing for shelters, working to ensure that they're properly performed and Follow-up is provided as necessary. There are multiple telehealth providers for physical and mental health that are available and continuing their coordinated efforts. The City Rescue Mission has available designated space for symptomatic cases, but so far there's been very little need for that. Some space is being repurposed. In fact, the symptomatic area is still retained, and it is self-contained, separate from the general homeless area. Welcome, sir. Alternative care homeless shelters involving the Homeless Alliance, Oklahoma County Social Services, and other partners are working through planning and including a lot of contingencies that they are identifying and getting in place should they be necessary. Continued outreach efforts to the homeless currently not in shelters and monitoring of that population. PPE supplies are improving. City County Health Department is still requesting donations of basic items. You can go to their website, occhd.org, for additional information. Severe weather sheltering continues to be a bit of a concern. Encouragement to maintain social distancing and make a plan early, maintaining awareness. Internal to Oklahoma County government, the declaration that we are under, emergency declaration, was approved by the Board of County Commissioners on March 25th, and we continue to emphasize Ready Op. For those who have not gotten signed up on that, and they need to please contact Mr. Matthews in the HR office to do so. Oklahoma County Court Clerk's Office still providing marriage licenses, and paperwork needs to be prepared before coming, and an appointment is still necessary. And we've had several discussions with the court clerk, and he is working on reopening procedures and strategies. He's got some good things that he's working through to hopefully be able to pull together and make this a safe opening for the court system and the many people that are involved there. Oklahoma County Clerk's Office has shifted to a 9 a.m. to 3 p.m. schedule, and the county treasurer is now taking cash payments on the third floor, requiring masks and one person to be served at a time. The through-the-door numbers on the 30th, we had 156, which we only had 153 on Wednesday. And on the 30th, or yesterday, there were 40 inmate shuttles compared to 52 on Wednesday. And VPOs and marriage licenses are still creating significant traffic there. The disaster declaration applicants briefing, as we mentioned, has been completed, and we're awaiting additional guidance and project worksheet information. We're still waiting on information out of FEMA as to whether the state has been approved for the Community Disaster Loan Program. It's a different funding stream, basically, that I've mentioned on several occasions that will help some smaller jurisdictions. Again, we're still waiting on approval through FEMA. Oklahoma County request for public assistance has been submitted, and the Oklahoma County Emergency Management First Responder Personal Protective Equipment point of distribution is still in place. We actually, this afternoon, by 1 o'clock, we should be finishing up our 6th round of that. We received additional stock yesterday and subdivided, and a lot of it was distributed yesterday. Court and courthouse related jury trial and non-jury trial schedules now include additional scheduling for August, a couple of weeks in August and 3 weeks in September. And the June 15th jury week proceedings have been canceled. Notable, Oklahoma Medical Reserve Corps is still soliciting for volunteers, medical and non-medical tasks. If you're interested, contact okmrc.org. Warning signs and symptoms: fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell. And a reminder that they do not, someone that's potentially infected does not have to have all and necessarily any of those. I actually spoke with a fire chief friend yesterday who had all but a cough, I believe he told me, but he tested negative. So there's a wide variance in symptomatic situations. Personal protective measures remain consistent: frequent hand washing, covering the cough or sneeze, and wearing a face mask, social distancing, stay home if at all possible, and recommendation to open packages outside of the home or work area and leave shipping materials outdoors. American Red Cross and Oklahoma Blood Institute still requesting blood donors, and we still continue to see false information and encouragement to avoid social media and media reports unless it's known credible sources. And no authorization letters for essential personnel are being issued or required anywhere that I'm aware of. And take personal responsibility, practice preventative measures. With the exception of discussion or questions, that concludes my report for today's meeting.
I don't have anything at this time, but as we go through the agenda, it might be necessary to reopen time. So,
Sure.
For now, a motion to receive this report.
Got a motion, do I hear a second?
Second.
Motion second to receive report. Roll call, Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Thank you. Item number 4, discussion review possible action regarding BOCC department presentations. We have any BOCC departments that wish to present? Any information provided from anyone? Okay, no action there. Item number 5, discussion review possible action regarding presentation from facilities management. We'll hear a motion to reopen item number 5.
So moved.
Second.
Got a motion and a second. Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye.
Disorganized here, sorry.
We need a motion to receive documents.
So moved.
Motion, do I hear a second? Second. All right, motion and second to receive documents. Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Davidson.
Aye.
Barnes is an aye. Thank you.
Yes, sir.
The first item that was handed out to you is a small report on usage of disinfectant supplies. You can see the top half is usage using 6 employees and the rate at which we expend materials. Since our last meeting, we've put some numbers together that would suggest how much material would be used or consumed based on 30 individuals hand wiping and cleansing, disinfecting throughout the complex. We've also reached out to our janitorial service provider, UBM, and they can and will send to us an additional 20 individuals to begin hand wiping at a rate of $12.50 per person. This is actually provided for in their contract.
Per hour.
Per hour, correct.
Per hour per person.
That's right. This equates to right at $40,000 a month for that additional help, those additional 20 people. With those that we've added prior to this, you can count on about a $50,000 a month figure just for the personnel needed to wipe down using that methodology. Also, our supply rate of usage in terms of dollars is approximately $5,000 a month. That's an estimated figure based on 30 people. You'll see.
Keith, is that the current rate or when we add an additional 20 people?
That is the forecast rate of usage based on what we're experiencing now. You'll see that we're in need of hand sanitizer, and I think we've got some help coming there. Also gloves. We're working towards sourcing inventory for that frequency times 30 figure there, if that's the methodology you want to use. Also, we continue to install foot-operated door openers throughout the courthouse. I'm not sure as to how far along we are there, but I'm sure there's going to be need of Cleo's service because there's some complaint that shoes could be scuffed.
Is that
But whatever, you know, it'll be a boon for Cleveland.
We want these, but I want my shoes too.
I'm needing funding. If you decide you want to make a recommendation, based on these figures and estimates, I need to, identify some funding and put it in place in order to begin this in advance of the May 18th opening. I would almost suggest that we come in and establish a methodology and protocol so that the people we bring in know exactly what to do and where. Incidentally, that will provide us, this level of personnel will provide us 2 individuals per floor in the courthouse in the annex. But we need to bring them up to speed as to what to clean, how often, where things are, to be ahead of the curve when we reopen May 18th.
Keith, thanks for putting this together. So a couple of questions. The 6 people that are currently doing this, were those 6 people that we had basically on staff for the contract
No,
prior
these
to
were,
COVID, or these are ones?
we added 6 people.
Okay.
And funded that through, budget board shifts within the facility management budget.
So, sorry, go ahead. You mentioned that these additional personnel would be covered under the current agreement we have with them contract. Is that correct?
That's correct. I talked with Chantel just a little bit about this morning, and the contract does call for additional personnel if necessary based on this price. Now, it may be good business for us to go out to bid or collect data from other individuals, but again, Chantel and I discussing this morning, even using temp services, there are management fees and associated costs built in on top of the dollar per hour figure for the individual.
Yeah,
So we
generally about a 50% markup.
we have that management in place through UBM now, and I think we would enjoy an economy of scale there.
Were the original 6 supplemental also covered under contract, or is this an addendum to the
They
contract?
were covered under contract as well. Now, keep in mind, this janitorial contract expires at the end of this fiscal year. Chantel and her crew, I know, have documents prepared to go out to bid to solicit janitorial services. So, should this need to continue into the new fiscal year, there might be some transitional issues that need to be worked out. Maybe Chantel is listening.
I noticed that on hand sanitizer, you're waiting on your order. Do you have any indication when you may get that?
I'm not sure at this point. They said they won't commit, but I do have another source, and hopefully we can count on that.
You have another source that currently has it on hand.
Yes.
Price is the same, or
Yes.
so we can get it immediately versus we don't know when?
Yes.
Okay. When will we order it from them?
Limited
This
supply.
afternoon at 1 o'clock.
It's actually part of the PPE pod that we're operating through emergency management. We have a very limited supply, but I'm able to give him probably close to 10 gallons. He's going to be the 1 o'clock thing, or at least our original discussion was he's going to send someone with one of the dispensers to make sure this particular fluid will operate in those dispensers. And if so, I can give him 10 gallons at this point.
David has that involved currently, and what we've done is disassemble the automatic dispensers, and we'll use those plastic containers provided, refill those, and then reinstall them in the dispenser.
So Keith, if my math is anywhere close to correct, to provide for the additional staffing that you gave us the quote on and the additional supplies, we're looking at about $360,000 to get through to the end of the year.
Calendar year? Yeah, calendar year would be correct. Yeah, and that is assuming that the pricing does not change when and if we renew a contract for the next fiscal year.
And
And it doesn't take into consideration any spikes or supply chain hiccups that might happen during a problem with the supply.
right, so but for planning purposes and trying to identify what funding is needed, that would be a fairly good number.
Yes.
Okay. And so as I understand and reading about the CARES Act money, this would certainly be an expense that we could utilize a portion of the money that we've just received for.
That's my understanding. This is directly related and in response to this event. And it's not anything that we had intended or planned to do aside from.
And there is a BET meeting this coming Tuesday to begin to discuss that issue. So this information, Miles is on that group, Cody's here, and certainly we can relay that, but if you could be available, I believe that means at 10 a.m.
Yes. So my thought, Joe, in asking Keith to bring this to us was for us to make a recommendation to BET to fund this out of the CARES. That was the thought. Now, the 12 months, whatever we need to do for that we feel is best, that's fine. But I wanted him to bring this to for us to recommend BET or something.
Sure.
Do you have, David, what in your documentation that you provided, there's really not any guidelines for how long we should keep this up.
Correct.
Is there anything from CDC that says anything, Joe? Or I haven't seen anything that says you should maintain what you're doing now for the next 6 to 8 months. I don't think there is that.
I agree, Miles. I haven't seen that particular statement, but what we have seen in listening to various press conferences, reading various news reports, of course, it is the news, right? Is that we can well expect that there will be a resurgence. Now, whether that's Oklahoma County, that there will be a resurgence of COVID-19 in the fall. The guidance indicates that your expenditures need to be made prior to December 31 of this year, so the close of this calendar year, and that if you purchase assets, those assets can remain on hand. You do not have to return the asset. Of course, the guidance is pretty limited at this point. I think it's still evolving. But I think part of the guidance also says that a government basically has to take a reasonable action. I think it is reasonable to assume that we could purchase materials to continue to provide protections for our employees and the public that come into this building beyond the December 31 date. So in other words, build a stockpile, a reasonable stockpile. This would be this is an immediate action, and then it would be talked a lot, an evolving process as we go. So,
Absolutely. And I mean, that's where I envisioned the money coming from. So I'm on board. I think the only thing that I question is how long do we do it? But it's whatever the committee uses.
Won't those numbers suggest when there is a resurgence that that's in fact what is happening?
well, I can tell you, as I was driving back, listening to a report in Georgia, who is open for business, had 1,000 case increase from yesterday to today.
1,000 people, what percentage is that?
I don't know what the percentage is, but it's 1,000 more cases today than they had yesterday.
Okay, so again, any kind of specific instruction from any governing body, it sort of makes sense to do this through the end of the calendar year to me.
I think it makes sense to, based upon everything that we've seen and experienced, that we would plan on this through the end of the calendar year and stockpile to go into the next year.
I think we can do that as long as the supply chains return to normal. If there's like-minded thinking, it will certainly result in a run on materials like there were, like we saw in the first go-round. We're trying to keep a 2-month supply of materials on hand, and I'm hoping that by limiting our order rather than making a huge rush, we'll be more likely to receive materials when it's
Well, I'm not suggesting we order 1 million masks today. What I'm saying is that we should plan on, as we're going through this, approaching the December 31 deadline, that we would modify our orders in order to build a stockpile or meet the need that might arise to go past the date. I'm not saying go out and order all at once, right? Yeah.
Staged approach, the stock, available stock, the things I'm hearing is that available stock is going to somewhat continue to increase as demand that you're anticipating is going to increase as well. But there's additional manufacturers, additional supply, and the urgency factor has been reduced because of the emergency sense of what's going on. So I think a phased approach to building a reserve will certainly be prudent and available.
The only thing that might change here is, and certainly we're getting smarter and better at this as we go along. The only thing that might change is the methodology, the frequency, the number of people necessary to do a better job of disinfecting, a more thorough job of disinfecting. That might change these and drive these numbers depending on what we see.
But this is a good,
It's a beginning.
this is a good starting place, and we can adjust from there.
So for funding for this, Joe, your $360,000 number, was that inclusive of materials that just was UBM contract?
That was I believe it's inclusive of the materials that Keith mentioned below, a $5,000 a month figure and $40,000 a month for people.
That would be a $50,000 a month for people. Keep in mind, I can't continue the additional 6. The additional 6 that we put on once this began came out of our budget, and I'm having problems funding that from here on out. So that personnel figure more closely approximate a $50,000 a month figure. Plus $5,000 a month in materials.
$450,000 roughly.
Sorry, I should have.
No, that's okay. So, and given what Keith mentioned that we're nearing the end of the current year, and so this provider may or may not be the same entity.
That's right.
But for
at the same
planning
price.
purposes and allocation of some funding, we could recommend setting aside the $450,000.
Keith, were there extensions on that contract?
This is the end of the extensions that we're providing for.
Do you happen to know if we're out on the street for new bids for this service yet?
Purchasing has that prepared and we're ready to go now, is my understanding.
I'm sure you share the same concern as I do, all this swapping sides and trying to ramp up the secondary or the new contract holder to the same level that we're at with this contract holder and keeping the same price. So
It's fertile ground for opportunity.
yeah, absolutely. Well, I mean, I would make the motion that this committee recommend to, I guess currently to BET to fund $450,000 for this contract and for Sanitizer,
Expansion of facility sanitation.
there you go.
Joe, you mentioned stockpiling materials or supplies. Would you anticipate doing that for the entire fiscal year, next fiscal year? If so, that should probably be made as part of this calculation now.
Stockpiling enough material for the next.
So enough supplies.
I think I would like to get an idea, perhaps survey, not only you as the facilities management director, but our elected officials and our department heads as to what PPE needs they might have before going to that next step, Keith. So I think what I'll do is when we've gone through all these items, I'd like to go back to item 1 and perhaps see if this group is inclined to instruct Mr. Barnes or ask Mr. Barnes to do that so that we can begin to get an idea of what our both short-term immediate needs are, as well as, okay, let's look at beyond the December 31 timeframe. What might we need in terms of a stockpile?
Okay.
All right. Quick question. As far as the CARES Act funding, it's just sitting in a bank account. It has not been appropriated. Accounts haven't set up for which expenditures can be. That is all yet, correct?
To my knowledge, that's correct. And I think that's part of the discussions that we'll have on Tuesday.
Okay. So effectively at this point, what this motion would be is to add this to a CARES Act funding watch list.
Yeah. Essentially, I think that's, in my mind, that's the approach that we probably will want to take.
And that is in part because the money has not been appropriated in our accounts to which we can encumber against set up.
Sure. And also it's ever-changing landscape, so we don't really know what we're going to need, in the future. So I think a watch list that has the things that we really anticipate needing, plus some out-of-the-box thinking, hey, what if this happens? We might need X, Y, or Z, and we go ahead and build that into it. So we already know what those costs would be, and we may not even ever need that, but just a mechanism for tracking and current needs and potential future needs.
And then as Keith mentioned, he shifted budgetary allocation within his budget.
Yeah.
To cover those 6 people.
That shift should be able to be reimbursed
under
to
the
them.
CARES Act as well.
100%.
Yeah.
As well as all the extra time that you people are.
And the extra supplies that were purchased for this.
Time, supplies, all of them.
We can do all of that. What I'm worried about is the continued funding for the 6 people that we brought in.
Well,
So I don't want to watch too awfully long here.
well, your uptick in terms of the funding for those 6 should have been taken care of
Through this month.
through the end of the year.
Through May?
I believe that was through May. I don't know that was through the end of the year.
Okay.
Well, either way,
Either way, through May, yeah. Well, I'm sure that they'll get these accounts up and running and begin to be able to encumber the funds.
yeah, and I think one thing that we'll probably want to do is have facilities track their historical spend on sanitation supplies like Clorox wipes and sanitizer, and then we can look at what the spend is for this fiscal year and compare it to the last 3 or 4, and you'll get a really good idea of what is addition. Because if we spend the same amount that we've always spent, then you can make the argument that that wasn't needed. So anything above the historical spend is, I would think, applicable to the CARES Act funding.
So, Miles, do you have a motion or a recommendation or?
Just a motion for recommendation of funding for the increased sanitization of county products. How about that?
And you
To
want
the tune of $350,000. What was it?
450.
450?
Yeah, so how about Miles, we recommend the BET that the COVID-19 or the CARES Act funding watch list would include $450,000 for,
Well, they don't have a watch list.
well, there's a create fund, whatever. An additional 20 people, Keith, is that right?
Yes.
20 people and associated supplies.
On top of the 6.
On top of this. Right.
So 26 more than the historic number.
26 more than what we're currently contracting. Yes.
Joe, would you also like something that relates to backfilling Keith's budget for the additional 6 that he's had so far and the additional supplies that he's had to purchase? Because those are going to be real deficiencies that may hamper him finishing out his fiscal year in his budget. Because those are real expenses that we've already incurred.
I don't need a recommendation from this committee to actually, for BET to decide how to spend. This is more just, my thought was, this is what we're looking to do. Let's get everybody on board for that. We've already done Keith's deal. We should, BET should just slam that through. I mean, if we want to recommend that we back pay Keith.
Right, but you can instruct Keith to have that information available to provide BET.
Well, if anybody wants to get funded from the CARES Act, I would hope they would provide that information. I would hope that we wouldn't need to instruct people to do that.
So here's what I think my preference would be after listening to some of this back and forth. That to prevent this from becoming so convoluted, and this group recommending this but not recommending this as it relates to CARES with the CARES Act funding, with BET about to meet, that BET would create a watch list, and then individual offices or department directors, much like they do during their regular budget season, would just make requests to add items to that watch list. I don't want to try to, and then I can show up, Keith can show up, anybody else here can show up and say, but I think it's important that that's the first step, the initial step beyond getting the money appropriated. So I'm not going to make that motion. I'll withdraw my motion and just go to BET myself.
Just so that you know, those budget board transfers that have funded our efforts to date leave facilities in good enough shape barring any kind of big disaster. However, if there is something that happens, elevator goes down, a flood, anything that we deal with ordinarily, there might need to be an emergency budget board to handle that and do a transfer. So we have some funds that are scheduled to lapse, and we use that funding to provide for what we've done today.
Keith, none of this anticipates any fogging or deep cleaning like we've talked about previously. Anything that you provided us today?
No fogging, no spraying. The methodology will be what you see that's being done today. Alcohol solution or a bleach solution on a rag with someone wiping down those surfaces that are touched. Benches in the courtrooms, door handles, door knobs, doors themselves, railings, those kinds of things. And it's anticipated we'll do this 3 times daily.
Okay.
So the secondary motion has been dropped, correct?
The secondary motion?
The
Motion after the original motion?
The BET motion is not. Yeah, I'm just going to let Keith or the BET, my preference is let them do this. Okay. Any further discussion for facilities management? Motion received, yes. Thank you. Get a second for that.
Second.
Motion second, receive update from facilities management. Mr. Matthews.
Aye.
Mr. Wow. Aye. Mr. Davidson.
Aye.
And Barnes is an aye. Thank you.
David, could you go down to 6? Mr. Hartman is here.
Sure, that's where we're at. Item number 6, discussion review possible action regarding presentations from Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor. You care to provide updates? Anyone care to provide updates or information from any of those departments? Hearing none, I believe there was a suggestion to possibly reopen item number 3. Is that correct?
Yes.
Okay. Entertain a motion to reopen item number 3.
That's my motion.
A motion, do I hear a second? And Mr. Matthews? Aye. Mr. Blau?
Aye.
Mr. Davidson?
Aye.
Barnes is an aye. Yes, sir.
Okay. I think perhaps, Mr. Harmon, did you want to talk about some of the needs possibly for the, have you been able to identify those yet, or you just want to wait a little bit?
Sure, Mr. Blau. I had reached out to Mr. Thompson about just in the courtrooms, what the plan was, hand sanitizer going to be available, and potentially masks for witnesses, that sort of thing. So, I mean, it sounds like from listening to Mr. Monroe's presentation that a lot of work's going into that. I would encourage that, as many of those hand sanitizer units that we can have inside the courtrooms, outside the courtroom, be made available, preferably the automatic version where you don't have to touch. We can only social distance so much in a courtroom, particularly when they go back to the 50 limit, which I'm hearing will take effect on June 1st. So that was my concern. I was asking partially because there are some grant funds available through the state district attorney's council for not just DAs but law enforcement agencies statewide. I'm trying to determine what we need to ask for our employees, as opposed to for inside of our office, as opposed to what we might need to ask for the courtrooms. And it sounds like the courtrooms are going to be pretty well taken care of, based on the conversation that I've heard today. Of course, we won't know. I'm hoping to get our grant application in where we ask for some PPE by Tuesday, and then it'll be considered next Friday. So I won't know until it'll be approved or not, but we're planning to ask for just the same thing everybody else is asking for: mask and hand sanitizer. I don't know that we're going to go the partition route, but don't know what the future is.
If you wouldn't mind, knowing that you're going to pursue those funds for PPE for your office, to also maybe share that with David. As you heard, I'm going to ask that he be made the point person to kind of survey as to the needs of the individual offices and departments for PPE. Share that with him in the event for some reason your funding weren't to come through. Perhaps we could help supplement that as well. So you'd be willing to do that?
Yeah, I sure will.
Okay.
I sure will. And I don't know, I don't want to steal Judge Elliott's thunder, but he and Judge Hammond reached out to me yesterday afternoon, and with Mr. Prater. And when we reopen, we're about one-third staff level right now in our office. We're rotating people in on, it varies somewhat, but generally one crew every 3 weeks, to try to minimize the chance of if somebody got infected, they had to quarantine in our office. We plan on going back full staff May 18th. The original plan was to start back with preliminary hearings, which are on the 5th, 4th, and 4th hours. All preliminary hearings that day. This decision I expect to be made later today. Judge Elliott is to just go forward with in custody defendant preliminary hearing those first 2 weeks, and kind of ease our way back into it. I think it's Judge Hammond put a soft open, so that we don't try to overload the system. Because, as you know, we can limit the number of people on elevators, the number of people in the courtroom. Those people have to go somewhere. They're in the building. And whether that's our witness center or the hallways or the common areas, it could create additional problems. We looked at kind of the numbers of witnesses we had coming in, civilian witnesses, that week, and it ranged from about 31 on Monday to 2 on Thursday. So a pretty wide variation. That doesn't include Oklahoma City police officers, because we go through a different route to subpoena them. It doesn't include our witnesses on special victims because we have different witness coordinators and a different witness area for that. So the numbers are pretty high. I don't know the breakdown as far as in custody versus out of custody, but that's going to be an effort those first 2 weeks, or I guess I should say those last 2 weeks of May, to try to minimize, restart, but minimize the number of people that are going to be in the courthouse, particularly on this floor of that building. Questions?
No, thanks for coming.
All right, thank you.
Thank you.
Okay, so in an effort to try to get a handle on what PPE we might need, both for our employees and potentially for members of the public who were to come down to the building, I'd like to ask that we appoint David as the point person to survey our departments and the elected officials office, including David Lisco, even though they're not, as Ms. Harmon said, they're pursuing their own funds. The public defender's office receives their funding primarily through the state, but go ahead and reach out to them as well. And so we can begin to get an idea of what needs we might have. And then we can convert that into dollar figures that we could then give to BET. So that would be my motion.
Okay, a little further discussion on that, and it relates to a couple of things. I'm glad to reopen this. I've got a couple of documents that I've shared with some folks. I pulled together committee topics, just bullet points that we've been discussing during these meetings that I didn't want to lose. So they're just really internal reminders to us, and some of the questions in regard to what you were just describing come to mind, particularly in the area of PPE. We're talking about employees, we're talking about courts and public defender's office and those kinds of things. The first question that comes to me, I can very easily identify the number of personnel and the number of public visitors, but the number of masks per is a question. And how deep do we go on that? So when we're coming up with a total PPE count, that's going to be a big issue as to how far. But you'll see I've got several bullet points here. My recommendation on the visitors is anybody doing business at Oklahoma County, that they wear or bring a mask. And then obviously there's going to be some that do not, and we would just fill that gap with internal stock as they arrive, should that be necessary. Becoming the mask distributor for all of geographic Oklahoma County could be a bit overbearing. So we'll have to answer some questions about how many masks we require, or how many, we're going to issue, or people should have on hand, whatever, to come up with that count. The other document I have also that I plan on emailing to elected officials, department heads, others today is basically some guidance. Mr. Monroe will certainly be interested in this, as opposed to the 453,000 different CDC documents that I've pulled, titles and web links to about 5 key essential documents and some bullet points that I've continued to see repeated over and over and over in all of the CDC guidance. I mean, there's certain phrases that they're catchphrases. So this document you'll be getting a copy of today, and it provides generic. There is no, in fact, I even make mention here that we've been requested of this group to provide very specific information, pinpoint accurate, as to frequency of treatments, type of treatments, repeated, all those kinds of things. And there very simply is no such guidance. And so my thoughts are, and discussion as we talked about Wednesday, when you originally developed the scheme, which has apparently worked quite well for the twice a day, all floors, that kind of thing, you just identified, for whatever reason, a benchmark of, okay, here's a goal that we can attain. This is realistic. It seems prudent. And we'll likely end up doing a similar fashion for the reentry, the reopening. It's coming up with a strategic goal to try and achieve. You've already mentioned cleaning 3 times a day. I've got on good authority that the twice a day thing is actually being far exceeded. People apparently are doing a very good job of that, and they're all over the facility multiple times. So I think this group's setting a target as a recommendation to work with Mr. Monroe, because there is no specific, you will do this on the hour, every 2 hours. They repeat buzzwords like routine and daily, or before or after each use. Those phrases keep getting repeated over and over. So that's really the most specific guidance as far as frequency of cleaning that you can glean out of any of the CDC documentation. And believe me, I've read far too much CDC documentation of late. But this document will provide some broad parameters and reference several key documents that I think will be of interest to you and your staff. And I'll provide both of those documents. But back to the question on PPE, before I come up with any ballpark estimates on what we would look at, obviously we multiplied out times whatever hypothetical time frame, back to the same discussion we had on the cleaning stuff and developing a reserve in-house. There's some unanswered questions there that we'll certainly have to. I'll try and identify a baseline, and then we can just apply math to it in whatever direction we go to expand on those numbers.
And on the PPE, is the bandana good enough?
Actually, cloth is something that's recommended by CDC, and one distinct advantage to the cloth is that it can be laundered. Like I've got a stack of about 6 of these on my dining room table at home. Every morning I grab a fresh one.
Yep.
And that's something that's very good. Obviously, the public stuff. And there's a question that, thank you for asking that, Miles, because the issue of N95 as opposed to surgical masks. Surgical masks are quite effective. They're widely used. They're less expensive. I think a lot of people are a lot more comfortable in that type of mask than they are in a true N95 that makes you feel encapsulated. So we'll have to make a determination there too. I think in particular for the public that the surgical style would more than suffice.
Yeah, my thought is more about the employees.
Right.
So if we're going to provide them for employees, are we providing bandanas similar to Cassie's or similar to Gretchen's?
Yeah.
I think that determination needs to be made.
There you go.
And I think the ones that people are making seem to be working. So,
Sure.
you know, if we provided Oklahoma County bandana.
Well, it allows you the flexibility of making a fashion statement too,
Right.
which we've all been seeing throughout the community. So I agree. The cloth type, although if we're looking at external supply sources, i.e. the Strategic National Stockpile or others, that will not include custom cloth masks.
Right.
We'll be looking at N95s and surgical masks.
Right.
And it appears likely, I'll just share with the group, it appears likely right now that I believe I've secured an initial supply, a substantial quantity of N95, of surgical masks, of 4 sizes of gloves, possibly to be delivered as soon as Monday. For employee, court, internal use only, visitors, those kinds of things. It appears. I will be able to update that when it's in hand.
And then what's our ability to not allow individuals into the building that aren't wearing some sort of PPE? That's one of the things that probably has to be asked.
That's part of this guidance of bullet points that we've discussed. That
Yeah.
we're going to have to nail something down.
Yeah. Pretty quickly. And that's probably something that needs to be officially asked of the DA. And if we're not allowed to keep them from coming into place,
Well, a
what are we
prerequisite,
allowed to make them do?
prerequisite requirement for entry of the facility.
Can we have that? And then if we provide it, can we make them wear it?
I would also add that the agenda for our meeting on Monday, I added one more agenda item specific to these type of discussions.
Okay.
So we can take that one item, and if we have a different meeting or recess to just discuss that, we can do that as well. But you're exactly right. That's one of the points we're going to have to clarify.
Have we talked to Cleveland County at all? Because they're opening up Monday,
Yeah, I have not.
full function supposedly, and taking people's temperatures as they come in, et cetera. Now, they don't have the traffic that we do, obviously, but
That touchless temperature,
from what I understand, that they use
the gun.
the trigger thing.
Yeah. I've heard of issues in a doctor's office. A friend of mine was actually brushed across the forehead, and then they laid it down and then picked it up and did it to an activation without cleaning the device. That was in his doctor's office. So guidance is obviously an issue there as well.
Yeah. Now, I have seen scanners, security scanners that are available that scan respiratory rate, temperature, these types of things that they're starting to roll out. That they're about $35,000, $36,000 a piece. They also
I wonder,
I would just preview for you that if we go down that road of temperature taking, I'm going to have a long list of lengthy questions that I think we're going to need to consider. Not only as it involves people's personal medical data, but also ramifications for turning people away who maybe you're under subpoena to appear in court, et cetera. And so
tricky.
we will need to think long and hard, in my opinion, about that.
I would suggest we start thinking.
Sounds like Monday I'll get to,
a good link. The restaurant guidance, for example, for Oklahoma City that begins today, throughout that guidance is taking the temperature of all employees. They have
I think it's going to become a norm.
What's that?
For a little while.
no specific in his guidance.
One of the things I did read is the employer or the employee takes their temperature.
That's right. Yeah, the employee can take their own temperature. Now, then you get into the credibility of the reading and how did you do that? And
We have a preferred method for you, Keith.
I would just forecast that I'm sure you all are aware that there are other conditions that cause people to run a temperature besides COVID-19.
Absolutely.
And so what medical professional are we going to have stationed at the door to determine that it is in fact COVID-19 as opposed to I have cancer?
well, if it's that's just one of 9 now potential symptoms. So if I come in and I sneeze on my way through the door, what's the difference?
You may not, I may not be running a temperature, I may not be sneezing, I may not be any of those 9 or more
Exactly right.
symptoms and carrying the disease.
Yeah.
So to me, it's more practical that we go a mass route and perhaps gloves, and we do the sanitation that we're doing. I'm afraid that the temperature thing may be a false sense of security that creates some serious ramifications on the backside.
Any of the medical components, I would agree with that.
But I'm not a doctor. So am my lawyer.
Or have you stayed at a Holiday Inn Express?
And I'm not an HR director or an emergency management.
Do we need to receive these 2 documents?
Yes.
Okay.
Move to receive.
All right. Have a motion to get a second to remove those, to receive those documents.
Second.
Motion is second. Mr. Matthews.
Aye.
Mr. Blau. Mr. Davidson.
Aye.
And Barnes is an aye.
Get a second on Joe's motion.
What was Joe's
We never
motion?
voted on that.
How long
To
ago was
appoint the
that?
emergency manager.
Oh, to collect the PPE
To collect
information.
PPE.
Second.
Motion is second. Mr. Matthews.
Aye.
Mr. Blau.
Aye.
Mr. Davidson.
Aye.
And Barnes is a nay. No, he's an aye.
Mr. Taylor.
And I have a copy of those 2 documents if you'd like those. All right, any more discussion under item number 3 or questions? Hearing none, I entertain a motion to accept that report. Those reports.
So move.
Motion is second. Mr. Matthews.
Aye.
Mr. Blau. Aye. Mr. Davidson.
Aye.
Barnes is an aye. Thank you. We are to item number 7. Next meeting date and time, which has already been established for Monday, May 4th at 12 noon in the BOCC room. Is that correct? Board comments. Mr. Matthews.
Thanks.
Mr. Black. Mr. Davidson.
No, thank you.
All right. Nothing from me. I will entertain a motion. We adjourn.
So move.
Second.
Motion is second. Mr. Matthews. Aye. Mr. Blau. Aye. Mr. Davidson.
Aye.
And Barnes is an aye. Thank you all very much.
No, Mama.
I think we'll have that.
Did we set a new record, an hour or 5?